All right, Heath, you ready for your first question?
Fire away, Bex.
Excellent. Okay, so first one was, why does my dentist no longer offer amalgam fillings? So that's the mercury silver fillings for people.
Right, yeah. Very good question. So controversial question too. So look, my belief around this is why your dentist probably won't be offering them or don't offer them, or they're reduced in offering them, is purely because I don't think people want them. We're a scientific community, we're a scientific industry, dentists. We look at literature. Currently, literature shows that there's actually not a whole lot of evidence around, is the mercury in them, is it bad, do they break my teeth? The evidence at this point is showing that it's actually quite a good material to put in the mouth. It lasts a long time. It's very forgiving in the mouth as well, so it's easy to put in. But I think the reason we're not offering is that people don't want it. Like, I wouldn't want it. It looks silver or it looks dark. There's mercury in it, and whether it has an impact on your body or not, literature says, it's debated at this point. But I think if there are some other options out there which are, just as good or close to being as good, or it takes more effort to be able to put them in, we should be offering them. And I think the public has kind of forced our hand in a lot of ways to be able to bring this sort of further towards to our patients, probably quicker than what we probably should have or would have liked to. But it's just stubborn dentists, we like to sort of to dictate terms sometimes. And in this way, I think in this regard, we're just sort of doing what we probably should be, and that's keeping our patients happy and giving them what they want.
Yeah, absolutely. But, I think it's important to note that it is still used in some practices, isn't it? So it's not completely, removed from the system or anything like that. So that's right. Yeah, absolutely. It's still, once again, literature shows it can be used. It's safe to use. So just because your dentist is using it, they're not doing the wrong thing. Yeah,
I think it's just more so why dentists don't tend to be using it as often is just purely public pressure or patient demand around this as to what they want. And fair enough too. It's their tooth, it's their body, they get to choose. So
yeah, and I mean, it's something quite common that we get patients through, and they come through because they want to get them replaced, and it's not necessarily for health reasons, it's for cosmetic, it could be for many reasons, but it's definitely a very common thing, isn't it, that we get.
Yeah, quite often. Like, I would think it's like a daily basis. People come in, they're wanting them removed. We do find sometimes, because of amalgams done 20, 30 years ago, some of the techniques weren't as advanced as what they are now. And we do tend to see a lot of broken teeth around these old fillings. So they tend to be quite a large job. Sometimes we talk about like ceramic crowns, onlays on teeth to be able to replace them, because sometimes the plastic composite resin materials that are used like routinely for fillings sometimes just aren't up to the task of what some of these old amalgams are able to do for so many years.
Yeah, absolutely. It's funny, I started in the industry 20 years ago, and I have never once placed an amalgam filling.
Wow.
Yeah, I know. I wouldn't even know how. So it's funny. That's when brilliant. This question came forward, and it's just like that could be considered a long period of time or a short, I don't know. But it's quite interesting that in all the practices I've worked in, they've never offered amalgam fillings for different reasons, as you've mentioned. But there you go.
Yeah,
cool.
Absolutely.
Thanks.
I think, well, I mean, what I'd stress around this is it probably, hear out your dentist, because they'll have a different thought probably to me, a different thought to you. But in the end, it's your tooth, and you get to dictate those terms. So if they think it's a compromise by using a white filling and they want to use an amalgam, you hear them out. It's your choice. So in the end, you decide. So, and your dentist is going to be comfortable going through those options with you.
Yeah, of course. Is there much of a price difference with, the white composite fillings to the silver amalgams?
I think for a lot of practices, they are a little cheaper, the ones that do offer them. Yes, but not much. I mean, probably where you'll see the difference is maybe a dentist might be happy to put in a really large amalgam filling, and they won't be happy to put in a large composite like plastic filling. So they'll want to go down a crown road. So that can actually be quite a big difference in cost between a large amalgam filling versus a crown.
Yeah, cool. And is there any sort of, you know, there's that, and I know you'll say this comes back to the literature and whatnot, but like cracking from amalgams, is there evidence to show that having amalgam fillings you're more prone to getting broken or cracked teeth?
Once again, controversial topic. Every dentist will have a different opinion on this. So amalgam many years ago, or even the techniques that we used when amalgam was the only material that was possible, it was fairly heavily cut into a tooth and they lasted a really long time. So I think there's a bit of a debate around, is it the actual amalgam itself, or is it the technique that was used to put it in that's kind of weakening the tooth right down and therefore creating cracking around it? So controversial topic and good question.
Yeah, it is a good question. And I think that's what I love about modern dentistry is you can, we use intraoral cameras. And so even if you're not sure what's caused it, whatever it is, it's there. And to be able to see that as a patient, I think that's so valuable. It's just like, I can see it crack, whether it's amalgam or the way that your bite comes together or whatever reason. I think that's really cool. So, okay.
Yeah.
Thanks, Heath. Yeah,
and I've also got to do I'm a very big CAD CAM user, so that's like a technology where you can scan in the patient's mouth and you mill a restoration out and you kind of then bond it in super strong. That is the best thing. That's the thing I use almost daily to replace some of these really big amalgams. So I think with that sort of technology becoming cheaper and also more prevalent within, at least in Australia, I think we can get some really, really good results with cheaper materials. Patient gets a great result. It looks good. It's strong. It's a really exciting time to be a part of dentistry, actually, with all of these new tech coming through.
Cool. That's those single visit crowns. When you say CAD CAM, is that just
single visit crown, mills it out in the chair, and you don't need a temporary crown. You don't need a second injection usually. The big system is called CEREC. That's the one I have. I absolutely love it. There's a few other systems out there as well, but it's been a big part of my practice for 7-8 years now, I think. But yeah, very, very great product.
Yeah, no, that's awesome.